Good morning and welcome. This is Bill Peterson, who's the Executive Director of the Iowa State Association of Counties. Thank you to our federal update. We appreciate you as county officials taking the time to participate, and also we want to thank our panelists. So we will be hearing from 3 individuals today, but I just want to lay out some housekeeping things before I started introductions. So all callers will be on mute other than the presenters, and we will be taking questions at the conclusion of each speaker's presentation. So generally, each of our 3 speakers will have about 10 minutes of information that they will provide to you, and then we will have about 10 minutes for them to respond to questions. We have some questions that came in advance, and at the conclusion of their remarks, I will relay those questions to them. I want to just introduce all 3 speakers before we get started, and then we will get started with that. So our first speaker this morning will be Director Doug Holscher, who is with the White House Office of Intergovernmental Affairs, and has been a great resource for county officials in the state of Iowa in his role as the Director of IGA. Secondly, we will hear from Senator Joni Ernst. Senator Ernst is someone that is very familiar to county officials, having been the auditor in Montgomery County for several years, and then was a state senator from that area of the state, southwest Iowa, and now is our U.S. Senator, one of our 2 U.S. senators in Iowa. So we're very thankful that she was able to join us. And then we will also hear our 3rd speaker will be Congresswoman Cindy Axne, who is our representative from the 3rd Congressional District. And Congresswoman Axne will will make a presentation and then answer some questions. So with that, I would first of all like to introduce Doug Holscher and say, Doug, I really appreciate all the effort that you and the President's administration and the IGA have put forth to keep local government officials informed across the country. So I'll hand it over to you, Doug.
Thank you very much, Phil, and thank you for the opportunity to join you all on the phone today. We've gotten to know several of you from the events we've held here at the White House with county commissioners, the first administration in our nation's history to invite every county commissioner or supervisor in America to come to the White House. And I know I've seen several of the Iowa county supervisors multiple times in the last couple of years, and appreciated your time, but also more importantly, your perspective to hear how things are actually working on the ground and the needs that you have. And so I appreciate the time today. I want to thank Supervisor Berlin Matthews and Auditor Carla Becker, Supervisor Richard Crouch, and Sheriff Brian Gardner for your leadership and the invitation to join the call. It's great to start a Friday, particularly it's a Good Friday with fellow Iowans. I'm a native of Hamilton County. I've had the opportunity to meet many of you through our State Leadership Days programming I mentioned over the last 2 years, and appreciating the chance to connect again this morning. Last Thursday night, I did a Zoom video chat with my parents who live in Hamilton County, and my older sister who lives in Kossuth County, and my brother and his family who live in Hamilton County. And so I know many of us are finding creative ways to stay in touch with the ones we love, but I want you to know I have people that I love in your communities, and I appreciate everything you're doing to serve them. I know many of you have taken significant actions to combat the spread of the coronavirus. emergency declarations, promoting social distancing, communicating with businesses and nonprofits. These efforts, while temporary inconvenience, really are making an impact in our fight against the coronavirus. And I think you've heard Dr. Birx and Dr. Fauci and the Vice President talk about some initial positive signs that our social distancing and the 30 days to stop the spread guidance are making a difference, and the work that you're doing is making a difference. And I want to just highlight that really echoing that 30 days to stop the spread guidance is the best way that you can help your fellow citizens and help bend the curve in every county across America. And so I appreciate the work that you're doing there to that focus. I know earlier this week, Dr. Fauci had a really good conversation with Governor Reynolds, and where he said, and I'll paraphrase here a little bit, that functionally Iowa's doing what other states are doing, and I'll quote, what they're doing is really functionally equivalent to that. And they really are doing a very good job, both of them, when he was referring to Iowa and Nebraska. And he also continued, I want to make sure people understand that just because they don't have a very strict stay-at-home order, they have in place the things that are totally compatible with what everyone else is doing. And so I think that's particularly important to make sure that states can do things differently but get to the same spot. And that's exactly what Dr. Fauci said after he talked to the governors. And so I know that Governor Reynolds, as a former county official, is working closely with you all on communicating. I know she's had communications with municipal and county officials across the state of Iowa. And as a former county official herself, she can put herself in your shoes. And we've had a great relationship with her, not only on this issue, but going back. And so I appreciate the work that she's doing. And I know she makes tough decisions, and I think some people who are criticizing her didn't know have all the facts in front of them, or maybe we're playing politics, perhaps more the latter. But it's great that Dr. Fauci and she had a good chat to get on the same page about what they're doing, and he was very complimentary of what the state of Iowa is doing. Response and recovery efforts are locally executed, state managed, and federally supported, and successful emergency management requires nationwide cooperation. The federal government scales best practices, coordinates key priorities, and provides regular flexibilities, guidance, and key resources to supplement but not replace private sector, local, and state resources. 2 weeks ago, the President signed the CARES Act, providing unprecedented relief to American families, workers, businesses, state, local, and tribal leaders. I know Senator Ernst will address the group later, and I appreciate her and Senator Grassley's efforts and really a bipartisan effort in the Congress. It really showed a good bipartisan spirit to help the American people. Through the CARES Act, we more than doubled the funds available through the President's emergency and disaster declarations to help state, local, and tribal leaders effectively respond. In addition to adding $45 billion to more than double the disaster relief fund, additional revenues to support include $1,200 tax payments to Americans, $150 billion in direct aid to state, local, and tribal governments, $340 billion additional emergency supplemental funding to combat the coronavirus outbreak, $500 billion for loans and guarantees that authorize the U.S. Treasury to support eligible businesses, states, and local governments to cover losses incurred, $100 billion for hospitals and healthcare facilities to reimburse expenses or lost revenues, $3.5 billion to allow states to expand child care benefits for frontline workers. One thing authorized by the CARES Act, the Small Business Administration's Paycheck Protection Program went live a week ago. The program offers small businesses, and you all as county leaders have great relationships with those small businesses. This program is designed to provide a direct incentive for businesses to keep their workers on the payroll. And as of yesterday, over $118 billion in loans have been authorized. A few days ago, the President called on Congress to provide more funding for the program. Unfortunately, I think it hit a snag with Senate Democrats yesterday, but we're hopeful and we're optimistic that we can get across the line, and Congress will once again come together in a bipartisan way to help our small businesses in Iowa and across the nation. The President has approved major disaster declaration requests quickly, as the governors have requested. 52 governors have had their requests approved as of this morning, And Governor Reynolds was in the first 5 to submit her request to the president, and so being ahead of the curve once again. The governors remain in control of the National Guard, and we're providing resources, unprecedented resources across the country to the Guard to make sure that they can be part of the solution. A few further updates. The Project Air Bridge, which you may have seen in some of the press briefings, FEMA continues to coordinate the transportation of critically needed personal protective equipment, or PPE, across the country. The Air Bridge is helping reduce time it takes U.S. medical supply distributors to receive PPE. As of this morning, 24 flights have landed from around the world containing those critical items. 49 flights are scheduled over the next 3 weeks. These deliveries are in addition to the PPE that has been distributed from the Strategic National Stockpile, so on top of, not instead of. These resources build upon historic regulatory flexibilities and funding provided by the federal government, and has given the state of Iowa, local, tribal, and private sector partners the ability to nimbly respond to the pandemic. Some specifics on that. HHS and CMS obligated more than, so the CDC obligated more than $6.3 million in coronavirus preparedness and supplemental funding to assist testing and surveillance. On March 25th, CMS approved Iowa's request for an emergency Medicaid waiver, providing maximum flexibility needed to care for Medicaid beneficiaries during the public health emergencies. HHS has also obligated $11.7 million in CARES Act funding to support 14 health centers in Iowa. From a FEMA perspective, they've obligated more than $44 million already. So they're moving those, they're getting the requests from the states, they're moving those very quickly to assist the states, and particularly the state of Iowa, on that specific request to respond to the coronavirus. From the National Strategic Stockpile, FEMA has arranged for the delivery of 199,000 N95 respirators, 283,000 surgical masks, 57,000 face shields, 47,000 surgical gowns. I saw that the governor yesterday is breaking down the data of supplies and hospital capacity in each regions in the state. I think that's a great best practice that, quite frankly, we're going to share with other governors around the country to make sure folks can see where the capacity is, and it shows transparency and helps ease that fear out there. And so that data that the governor is sharing is very important. The Department of Agriculture in mid-March, USDA issued multiple waivers to grant maximum flexibilities for the state of Iowa for children, seniors, and individuals with disabilities to get food during the national emergency. Department of Education suspended federal student loan payments and waived interest during the federal emergency, which could have held up which could help up to 409,000 borrowers in Iowa with over 11.5 billion in loans and interest. So that's a top line that could be impacted. On April 1, the Department of Education granted Iowa's request for a waiver of assessment, accountability, and certain reporting requirements, allowing the state maximum flexibility to serve students in this time of need. Just yesterday, Secretary DeVos announced $6 billion in emergency cash grants for college students impacted by coronavirus across the nation. In the Small Business Administration, just a few more updates and then I'll take some questions. The SBA, in addition to the PPP funding available under the CARES Act, the SBA declared an economic disaster in Iowa on March 21st, allowing the access to working capital loans to help small businesses, small agriculture cooperatives, and other businesses in agriculture. Most private sector, nonprofit organizations of all sizes meet the ordinary and necessary financial obligations to make sure they can continue to meet their mission. The SBA has also deferred payment on all pre-existing disaster loans until the end of the year. The Department of Labor expanded paid sick, family, and medical leave, has offered flexibilities and grants for unemployment insurance, and up to $100 million in dislocated worker grants. And I know the state of Iowa is working very quickly, and I think they're going to be in the first third of states on the unemployment insurance implementation. And so that's another good example of Iowa helping provide solutions and leading the way. The Department of Housing and Urban Development, HUD, made more than $33.9 million in COVID funding available to Iowa via CARES Act authorizations. And then finally, on March 18th, HUD announced foreclosure and eviction moratorium for single-family homeowners and with FHA-insured mortgages for 60 days that will benefit thousands of Iowa homeowners. I just want to close before I take a question or two. On behalf of President Trump and Vice President Pence, the task force and the entire administration, I've seen it since January. People are working around the clock to help serve Iowans in every state across the country. We need solutions at every level of government. And thanks to the partnership with the governor and local officials, mayors, and county commissioners in Iowa, that's exactly what we're doing. I want to thank you for the hard work you're doing and will continue to do to serve your fellow citizens at a time of need. And Bill, I'd be glad to take some questions.
Okay, thank you very much, Director Holscher. I guess one question that popped up from one of our members was, has the White House issued any guidance on the HHS stimulus funding yet, on how those funds can be used? Do you know that, or would that be a question you could get back to us on?
Well, I can get back to you. I probably need some more detail because there's a lot of different HHS programs as part of the CARES Act. So I want to make sure I'm answering exactly what the question is getting to. If it's regarding the hospital payments, CMS has already been pushing billions of dollars out the door for hospital systems through existing prepayment programs. But there's also the $100 billion in the CARES Act, and that is getting broken into a couple tranches, including for the uninsured, which is a great, I think, a great way to make sure we take care of folks in this national emergency. But I probably need some specifics on what exact program you're looking for, Bill, and we'll follow up with you offline.
Okay, thank you very much. A second question was from one of our county engineers in the state, and I believe the president had mentioned that at some point an infrastructure package might be very helpful to get the economy moving. One of the challenges that I'm sure is happening both at the federal and the state level is with people cutting back on travel. Many of our road use tax fund pools are seeing a significant shortfall, which means many of those infrastructure projects, particularly the counties would use related to road use, road improvements and construction, might run short of money, and we won't be able to hire the contractors to do that work. Is there any thought about how an infrastructure package might be put together to help out in this area?
Yeah, so I know the president has talked about this a couple times, and he remains interested in trying to improve our nation's infrastructure, which hasn't been appropriately prioritized for, I think you could argue, the last 50 years. And so we're dealing with a challenge that's many years in the making on that front. But this does provide, perhaps with a more bipartisan spirit in the Congress, a chance to revisit that topic. On the road use tax fund example is one of hundreds that you could probably give for state, local, and tribal governments across the country where revenues have dipped. One thing that I encourage everybody to look at, and this will require some coordination with the state of Iowa, for those that do have cash flow challenges, the Federal Reserve is in the process of opening a loan center. It's going to be direct loans for, I think, about 70-some states, for the states, and then the largest cities. But there could be opportunities to be explored for the state and other states across the country to be the coordinator of further loaning to sub-entities within the state. And so that might be a way. I think it's zero interest loans. You'll have to take a look at the guidance that they put out. But that's a way to help with that cash flow issue that I think probably, whether it's healthcare or infrastructure or social services, the revenue dips in a variety of different ways are impacting. And so I would encourage you all to keep an eye on what the Federal Reserve, it's an independent agency, so we'll help try to highlight information when we get it. And we'll try to make some connections with that information, but that would be one thing I'd keep an eye on.
Okay, thank you very much. So Doug, again, I want to just say that we really appreciate all the work that you and your office has done to keep local government officials informed and involved, and we will make sure and provide contact information for you and your team for our folks so that they can reach out directly to your office, because I know that you're always willing to help them out and sort through the challenges of dealing with the federal government. So thank you.
Great.
Will you be staying on the call, or do you have to leave?
Nick Barbdick from my team will stay on the call. I'm going to have to jump off, but I appreciate everybody's service and the sacrifice you're making to serve your fellow citizens. I'll get out of the way so Senator Ernst can give her update, and appreciate the partnership with the Congress. Really a good bipartisan spirit. Thanks, Bill, for your time.
Thank you. Senator Ernst, how are you today?
I am very great. Thanks so much, Bill, and thanks to everybody on the call as well. I'm looking forward to giving an update.
Okay, Senator, would you like to just get started?
Yes, absolutely. I'll just dive in, and thanks to all of you as well. Bill, your team, I know that you've been working diligently through so much of what's going on and how that's impacting our counties, and for all of my great friends out there on the call as well. Just really appreciate all of the leadership that has been exhibited through the pandemic. We know that you are right where the rubber meets the road and working with your constituents to make sure that they are safe and that they are still receiving the services necessary through your offices. So thank you so much for doing that. I had some business at my own courthouse the other day, and God bless them, you know, the ladies came down and met me at the door and handed off the paperwork. And, you know, I know they're doing absolutely everything they can to make sure that our lives are still flowing with those essential services. So thank you all so much. Just a little bit about the packages that we've passed, and I'm going to focus heavily on what I worked on specifically because I do sit on the Small Business Committee, and I'm happy to take questions about, you know, whatever you might have and give updates in some other areas. But specifically with the 3 phases of the bill, Senator Grassley and I each worked in our own respective areas and with our colleagues across the aisle to make sure we were focused on the workers, families, small business. Again, that's one of the areas I focused on. And then, of course, all of those that are in our healthcare community and on those front lines. So the 3 different phases. Phase 1 is the first bill that was passed earlier last month. And what that did, it provided additional funding and resources for our federal, state, and local partners and our health officials right here in Iowa. And then a few weeks ago, we did finish and pass phase 2. And briefly, what that did, it provided for free COVID-19 diagnostic testing. It did increase access to really important food and nutrition programs for our children and seniors. And we knew that that would be important because we do have so many families reliant upon those programs now. And it also provided emergency paid sick leave for workers and Iowa's moms and dads. The last phase, the one that most folks are interested in, is the overwhelmingly bipartisan phase 3 package, $2+ trillion of aid for America's workforce and those in the healthcare industry. And so here's just a broad overview of some of what was included in that package. Something you are interested in very much, local governments. The CARES Act provides $150 billion to the Coronavirus Relief Fund, which is allocated to governments across our states, territories, and of course those that have tribal areas. There is specifically $139 billion allocated for governments in the 50 states based on their populations, which means Iowa will be receiving that $1.25 billion. And then, again, I think Doug mentioned this, but funding for the Federal Reserve to purchase up to $500 billion in short-term debt from local governments and $100 billion in funding to help local hospitals. So that is very helpful having that out there. Now, the direct cash assistance that Iowans are talking about, this will also include seniors. I had heard from AARP Iowa. They were really wanted to make sure seniors were included in this. So I worked with Senator Rubio, who chairs small business, and with Chuck Grassley in finance, making sure that all of these folks were included. And those who earn $75,000 or less, they are the ones that will get that maximum of $1,200 each. Married couples earning up to $150,000 will receive, that maximum of $2,400. And then for each additional child, 17 and under, they will receive $500. And then we have bolstered unemployment insurance programs across the United States by an additional $250 billion. And as we've seen from our Iowa numbers, it is absolutely needed. So working through some of the small business programs, the most popular one that we have seen so far is called the Paycheck Protection Program. And this is a $350 billion pot of money. It's a forgivable loan program that is now available to small businesses. So loans are available for businesses with 500 or less employees, including those that are self-employed, nonprofits, and child care providers. And those nonprofits and child care providers I work specifically on with Marco Rubio as well. Now, if they keep folks on payroll or rehire workers, those borrowers can be eligible for loan forgiveness equal to the amount that they spend on payroll, interest on mortgages, rent, utilities, things like that during an 8-week period. And what we were attempting to achieve with the Paycheck Protection Program is helping these employers keep folks on payroll. That's the entire point of this program, is so that they keep their jobs, they keep receiving the medical benefits from their employers and so forth, instead of these businesses sending them to unemployment. So that's the point. Keep the jobs. And then all of the loans are being handled locally through our local banks and credit unions, and they are making and approving the loans right now. And those dollars should be flowing out the doors any day now. So those are just a few kind of top level things, just specifically from the CARES Act. But I do want to talk about a few other things that were brought up with Doug as well. I have been working through a number of the hiccups that have been happening with SBA and the Treasury regarding a number of these programs that Iowans really do want to take advantage of. And so I was on a call this morning, just one-on-one with Secretary Mnuchin, and then I visited with the SBA director, again, one-on-one, Director Carranza, and visited with them specifically about issues that we're hearing about from Iowans. And they were very, very helpful. Some of the programs are pretty well locked in. We may not be able to make as many changes as what we would like right now because it's already in the process, but some of the issues that I've heard about, I did raise. I know that agriculture is hurting right now. All of us have ag industry in our counties. And so I spoke directly with the president again on Tuesday evening. I was able to visit with him about some of the issues and challenges that we're facing. And then I spoke again with Secretary Perdue on Wednesday morning. So again, some issues that we are trying to work through. We do continue in the Senate to meet, as senators through webinars and other types of platforms to make sure that we're still doing the work necessary that we would be doing normally if we were in Washington, D.C. I'm calling in from Red Oak is where I'm at. So one thing that you visited about with Doug was the highway reauthorization and funding for our infrastructure. And I had a meeting yesterday with the Environment and Public Works Committee headed by John Barrasso of Wyoming. We met as Republican senators to talk about, okay, we need to move forward. The Water Resource Development Act, we need to have that reauthorized to move forward. The Highway Plus bill, the FAST Act that we passed last year, 21-0 out of EPW. We know that needs to move forward. And then we also had a discussion about rural broadband. That actually goes through commerce, but it is of particular importance because we think it should be included in an infrastructure package as well. And thankfully, the Commerce Chair, Roger Wicker, is also a member of our EPW committee. So we had a very, very healthy discussion about these packages that need to move forward and then the funding necessary. We all had a number of different ideas on how we can cover down to make sure these packages get passed, but we're providing relief to those counties and local governments as well as we're moving through that. So with that, I'll go ahead and stop there, Bill. There's a lot going on, and I wish I could go on all day, and I probably could, but y'all know me better. So I'll just stop there and take some questions.
Okay, Senator, thank you very much for that update. I guess one of the questions that came up in advance was, we understand that there is a fourth package that is being considered in the Senate, and I believe there's some activity in the House, so we'll hear from Congresswoman Axne about that. But there were a couple of things that our National Association has specifically been working on that would, I think, benefit counties here in Iowa. And one of those is that rather than having all of those dollars funneled through the states and then requiring counties to go through the state to get resources, that there would be direct funding to, I know that in the CARES Act that entities that were over 500,000 had direct access, but you know, we have a lot of, you know, I think I looked at the list. I'm not sure even Polk County met that 500,000 threshold.
No, they don't.
And
no.
So there's concerns about how those resources get there. So do you have any thoughts on what might be addressed in the next package, or if there would be any way that could be addressed?
Right, and one thing I would caution everybody, because I've heard this from a number of different folks that had concerns about those communities, 500,000 or greater, receiving direct assistance from the federal government. And just a reminder that the dollars that are being allocated for those larger communities, that's coming out of their state total. So they're not double dipping. It's just going directly to those communities that are affected. And the thought behind that was because those specific communities are the ones that are being hit the hardest by COVID-19. So they needed that money right away. And just remember, the assistance is tied directly to COVID-19. It's not to pay off any, like maybe in the case of Chicago, not to pay off any bad debt, you know, anything that they've had in the past. It is to be focused specifically on the COVID response and anything associated with that. And you could, and I can make the argument too, that when you have public transit systems that aren't running, they will need support, you know, and so forth. So all of those things can be included in that type of allocation. But moving forward, we will have those discussions because I have heard from communities like Cedar Rapids and others that are being hit by Corona. It would be nice if they had those dollars directly from the federal government. But again, a little caution there in that sometimes the federal government is not the most efficient in getting those dollars out to communities. So, you know, I'd have to look into it a little bit more, but I just be careful about what you ask for. So, but we will look into that because I have had a number of people that have brought that up. They would rather those dollars go straight into their coffers from the federal government rather than going through the state. So we'll look at that and see what those pros and cons are and make sure that, you know, we're getting the right information from all of you as well. So yeah, that's what we'll do. But also phase 4, first, you know, we need to make sure that phase 3 is working. I mean, this package has only been in place about 2 weeks now. It's $2 trillion. We need to make sure that those programs are working, and then if any corrections need to be made, we can do that in a phase 4 as well. Again, talk about what could be included in phase 4. I would like to see additional funding sources going to our healthcare industry. We know that our local hospitals are going to be hit very, very hard with not being able to do the elective surgeries and so forth. So I want to make sure that we are funding them appropriately. Infrastructure, again, I don't know that that will be a phase 4, but I think it is something that the president is extremely interested in, so that, you know, if we're looking long term, we could maybe even call that a phase 5 bill. But again, focusing very much on the local governments, on our healthcare industry, and then of course, you know, whatever else needs to be changed from phase 3, you know, putting that into that phase 4.
Okay, thank you, Senator. We appreciate your participation in the call and the fact that you and your staff members are always accessible to us. So I think we have some additional questions for you, but we have to move on to Congresswoman Axne. But we will be forwarding those questions to you and your staff. And as always, we really appreciate the work that you've done for the state of Iowa and your responsiveness to our needs. So
yeah, thank you, Bill, so much. And to everyone, thank you again for, you know, being so diligent in your response to your constituents. And my staff and I are always here to help. So please send those questions to us. We'll get responses back to you, Bill. And if anyone out there, I know you're in touch with colleagues, with members of your community, if you do need anything, whether it's related to COVID-19 or other issues, please reach out. We are ready and willing to assist. God bless you all. Stay safe and stay strong.
Thank you, Senator. Congresswoman Axne, I hope I appreciate you being patient, being on the call today. How are you today?
Well, I'm doing well. I actually have cleared out the office for myself at this point of the day, so it's nice to not have 2 teenage boys and a husband in here with me right now. So all good.
So you're working from home as well?
Absolutely. Really trying to practice the governor's advice. Our family is staying home, and I've been doing a lot of teleconferences, teletown halls. Just started this past week with picking up my county tours in a virtual perspective. So able to conduct a lot of work and have some answers for some of the questions you've been asking along the way here with all of the caucus calls we've been having in the House Democratic House Caucus. So glad to be on the phone with everybody.
Okay, so Congresswoman, please just proceed.
Absolutely. Well, thanks again, Bill, for having me here. Thanks to your whole team for putting this together, and for Doug to give us that good overview, and for the senator. I'm going to skip down to what I think is going to be more impactful for you all to hear at county level, because I think Doug and the senator gave a really good overview of the programs and some of the key issues that we're facing. So I just wanted to make sure that you were fully aware of some of the key pieces within the act that the counties could be taking advantage of. And then I've got some information for you on what we're working on for that 4th package as well. So once again, thanks for all of you for joining this call and for what you're doing at a county level. As I've been starting my 16 county virtual tour, I've made a focus to engage with the folks who are involved in economic development, healthcare, education, small businesses, et cetera, certainly emergency management, to make sure that I was understanding the issues that we're facing at a county level. I can't imagine doing this job without really engaging with my constituents on a regular basis. That's the job of a representative. So the information that I'm getting from the county tour is actually incredibly helpful in helping me push some new agendas up for that package 4 and possibly package 5 that we'll be working on. So real quick, want to point out about a half dozen specific funding options for counties if you weren't aware, and we can get you more details on these. First is, of course, FEMA, the COVID-19 Pandemic Public Assistance Simplified Application. This is where entities can apply for public assistance by completing a request for public assistance through FEMA's web-based platform grants portal. First-time applicants must contact their local or state emergency management department to get access to the portal if you haven't used that before. But states, territories, tribal and local governments, and certain private nonprofits may apply as eligible subrecipients. So local governments do include the counties, and there's opportunity there for you to find some funding for the issues that you're facing. The second is letting you all know that recently the U.S. Treasury has authorized, has a new authority, I should say, to authorize loans and make municipal bond purchases to aid state and local governments. Right now, that's for cities that are over 1 million and counties that are over 2 million. So again, going back to what Senator Ernst was saying in regard to some of the funding going to bigger cities, we have an issue here, but we are actively working on trying to ensure that we can get that number lowered. But just so you know, at this point, we can apply at the state level for this and filter that down to counties. So we should be encouraging us to get as much as we can at a state level and then sorting that out to get down to the county level. There are Department of Transportation grants. The CARES Act authorized $56 million for small and rural airports in additional fiscal year 2020 discretionary appropriations so that we could maintain regularly scheduled air service to small and rural communities. There is additional $25 billion in aid for transit systems for operational support to help protect public health and safety. DOT has not yet released guidance on this, but expect that to be coming. Fourth, there's a community, you're probably fully aware of all of this, we use these all the time, Community Development Block Grant and Community Services Block Grant with the Economic Development Administration. CARES authorized, that's CARES package, of course, is the third package that the Senator referred to that, that we had just put through. CARES authorized more than $6.5 billion for community development block grants. Those funds may be used, of course, for multiple activities and opportunities. So that's a good one for us to be looking at. We've got the Manufacturing Extension Partnership funding, and CARES authorized $50 million to that to help mitigate the local economic crisis and rebuild impacted industries such as tourism or manufacturing supply chains. For projects aimed at COVID-19 response, the cost sharing requirement has been waived and funding will be awarded in the form of grants. Additionally, the USDA has $15.5 billion in funding for SNAP. I think the Senator brought that up to help support states and localities. And then HHS was authorized $955 million for the administration of community living to assist local area agencies on aging in providing services to seniors, caregivers, home-based support, senior nutrition programs, etc. That we're still waiting on guidance as well. Those are some of the key pieces I thought you might be interested in hearing about from the county level. But I also wanted to let you know what we're working on in our fourth package. And this is where I really see an opportunity for less populated states like ours and smaller communities to have even greater opportunity than we've had in the past. I mentioned earlier that I'm doing my 16 county tour virtually. This week I spoke to stakeholders in Cass County, spoke with SWPCO there, Guthrie County, Page County, including the Shenandoah Mayor, Mills County, Adams County, Montgomery County, and then today I talked to Warren County and Madison County. So really engaging with the chambers of commerce, the mayors, folks involved with planning, and of course transportation and housing, to really understand what they're facing on the ground and what is working in the current coronavirus bills, but what is lacking. The best way to get that information is to meet with the folks. And so I'm pushing those ideas up to the speaker. Those will be sent over to her today. And it really does get down to those down and dirty questions. You know, when I was talking with SWPCO in Cass County, well, they're set up as a 28E agreement with the state. We've got to ensure that any federal money allows organizations like that to receive some of the funding. And that's the importance of having these conversations, because it truly is in the details where we're going to find the opportunities for our counties to have the most success. Let me briefly go over just a few things that we're working on related to the fourth package. And as the senator pointed out, we are actively working on a fourth package in the House. And quite honestly, we think there may be a fifth package after that. I do want to let you know that I heard Doug reference earlier that he said the Senate Democrats had shot down the fourth bill. Well, the request is for additional money for the PPP program, which we all want, and the speaker is all behind. But we also know that we have a lot of things to work out, and Senator Ernst referenced that when she mentioned that we've got to really make sure that we're working out those kinks within phase 3 as we move into phase 4. And those kinks are exactly what I'm hoping that we can fix, and it comes from those conversations that we're having with folks in communities like ours all across this district. So as you're aware, the CARES Act provided $150 billion for state and local governments. And as the senator said, but only with those 500,000 people or more could apply directly, which left Iowa out of this equation. I want to let you know we're working, House Democrats are working to ensure that smaller governments aren't left out of the next round. I'm a co-sponsor of a bill that we're putting forth, Small Cities and Towns Investment Act, which will be one of the pieces that allows us to put more money in the hands of our counties. The funds could be used to improve essential community facilities, build healthcare facilities, and expand public transportation, investments in child care centers, community centers, broadband, and much more. So we're looking to authorize an annual $10 billion appropriation there to fund those projects and help our communities just like those of you who are on the phone today. Another concern is that while that $1.25 billion will help significantly with coronavirus costs, the funding can't be used to make up for lost revenues, and we touched on that briefly. So just yesterday, I signed a letter asking that this be corrected, since one of the biggest issues our counties and local governments face is, having to make up for these loss in revenues. So they're looking at significantly lower tax revenues coming up. We mentioned that earlier, and that could force extreme cuts to the important services that you all provide. So I'm actively working on trying to figure out our best methods for shoring up that lost revenue. In that vein, I'm working on a bill to directly address that. The goal is to create a grant program funded with $250 billion for state and local governments to make up for lost revenues due to coronavirus and all the social distancing that's happened. The states would be in charge of compiling estimates for revenue loss for themselves and the municipalities within the states, and then submitting them to the Treasury Secretary. And then the Treasury would make the grant to the state to be further allocated to municipalities based on their share of the revenue decrease. I do understand what you mentioned earlier about we want money coming directly to the communities. As the senator said, she also said we got to make sure that can also be a convoluted process. I think that what we're trying to put in place can address both of those by ensuring that really the state is just the pass, obviously just a clear pass through where the specific requests are being pushed up from the counties directly based on formulas related to their lost revenue. So we're actively working on putting together that piece of legislation to ensure that we get more funding into our communities here in Iowa. And then got just a couple more things here. I want to let you know that at the leadership level, there is acute interest in serving our smaller communities. And as a matter of fact, the chairwoman, Lowy, chairwoman of the Appropriations Committee, on a call just a couple of days ago, really highlighted that she wants what she calls CARE 2.0 for the states to really be impactful for local communities, and especially communities under 50,000. She wants to see more to rural community funding programs in general, with a big focus on towns and cities, which would include things like CDBG, LIHEAP, targeted rural hospital funding, and more. But I do want to let you know that there is a lot of focus from her as well as the speaker on making sure that we're getting that money down to the people who need it most. We're looking at another $100 billion for hospitals, more funding for SNAP, and many other things. And the speaker is very much in tune with understanding why we need to get this money down into your hands. It's one of the things that we're pushing for in this next fourth bill. As I mentioned earlier, with the additional PPP money, we want to make sure it's getting down to those mom and pop shops. We want to make sure that those sole proprietors that are running the restaurants in our small towns are getting what they need. You know, we want to make sure that our small community banks can function well within the process and deliver for the communities like they would like to. I know that our Iowa small banking system is really a jewel, and they're doing everything they possibly can to help out, even when some of our larger banking systems are stopping the loan process. So our goal is truly in this next bill to make sure that there's more for states like ours and for our communities like we're talking about today. So that's the overview. I appreciate you having me here. I'll answer some questions, but we do have a resource guide on our website that we constantly update. It's axne.house.gov. Would encourage you to also take a look at that and spread that out to whomever you think might be interested in it. And again, thanks for all you do.
Thank you, Congresswoman. One question that we had from one of our members was about the money that goes directly to individuals. So if someone does not have a bank account or reliable address, how are they going to get access to those direct dollars that were authorized in the CARES Act? Do you know about that?
You know, that's a great question, and I don't have a solid answer for you on that, but I know that we've been talking about that. You know, certainly folks who are on any one of our social programs, we should be able to figure out a way to get them that funding. Some of us have talked about possibly issuing, you know, some type of debit card with their you know, funding on that so that they could use it. And, you know, because there's a lot of folks that might not necessarily be claiming taxes, or to your point, be us able to find their address, but if they're within any one of the social programs, we should be able to get that something out to them. So I appreciate folks bringing that up. It's something that we absolutely need to work on.
Okay, thank you. One other question, you did bring up the targeting funds towards small local governments. We certainly appreciate that. That is something that we have been, as an organization, and our national association has been promoting. One thing about the payroll protection program, and you addressed it a little bit when you talked about some of the agencies that were not necessarily covered in the initial CARES Act. For example, I think it's like 501c3s are eligible, but not 501c4s. And there are a number of those nonprofit agencies in those categories that do a significant amount of work across the counties in the state of Iowa that would not be eligible for that unless those rules about who is eligible were changed. So I appreciate your work on those.
Absolutely. And as a matter of fact, we're trying to get other pieces in, like we've got, you know, our hospital in Montgomery County they need to be receiving funds, but so I'm hoping that we can open that up for public hospitals as well. So we're trying to include some language in this, to your point, that ensures funding applies for quasi-governmental organizations as well as other organizations that are serving the public during this time that might not fall directly under that. Absolutely.
One other question that just came in had to do with, I don't remember if you mentioned whether there were any additional dollars to specifically supporting local county emergency management agencies. Would those come through the FEMA public assistance, or how, do you know how that would be handled?
Yeah, most likely that would come through the FEMA county assistance. That's exactly where I would go first. Again, they've got a grants portal there that's easy, I think fairly easy to use, but that's exactly where I would go.
Okay, thank you. I guess there were no other questions specifically directed to you. Did you have any final comments? We certainly appreciate you taking the time. I know that many of us, I'm sure you as well, are involved in call after call to try and share as much information with others as possible. So I just wanted to give you a final last word.
Well, thank you. You know, whatever you're doing, keep doing it for the social distancing, of course. That's what's really going to help us flatten our curve. Another thing that I'm really pushing for is that we get testing across the state. I did want to let you know, Admiral, I was on a call the other day with the Vice President, Dr. Fauci, the CMS administrator, as well as Rear Admiral Palachuk, who is working on supplies. And so they have a piece in place now, which I'm so grateful to hear, where there's a system that the Rear Admiral is using, where the healthcare industry can feed into it. He can see aggregated orders down to a county level, so that he can figure out where there's gaps between supply and demand, which is going to help him determine what needs to be done in regard to our trading partners and bringing in PPE, but also what we need to do to be making more products here. Further, there's some CDC guidance coming out regarding our healthcare workers, as well as rapid testing for our healthcare workers. And so we're trying to actively make sure that that testing gets equally allocated across the country. And then I want to just let all of you know, I'm really in support, and I had a call the other day with former Fed Chair Janet Yellen. It was really insightful, but one of the key pieces that she brought up was, you know, the best thing we can do for our economy, obviously, we all know this, is get people back to work. And unfortunately, within all this funding that we're doing, we're not spending enough of that pushing towards the antibody to ensure we can test folks and see if they're immune and we can move them back into the workplace. And so I'm going to push for more funding to support that. We're going to need to know this in the future. We're going to have to test folks and see what this looks like coming out of it. So let's get this done as quickly as possible so that we can start putting folks back to work, especially in particular industries, and we know that they're safe and that they're going to keep their coworkers safe. So we're really actively pushing towards that on my end as well. I don't want us to forget that this whole thing is a health emergency first and foremost. And if we can address some of those key healthcare issues, they're very important in helping us ensure that on the economic side, we're getting back up and running as quickly as possible.
Thank you very much, Congresswoman. Appreciate your time today. I just have a couple of housekeeping things to cover before we close out here. First of all, we have recorded this conversation, and all the participants have given their approval for us to use the recording and provide it to those that were not able to participate in our call today. So later on today, it should be available up on our website for any individual that was not able to participate in the call today. I also just want to, again, thank all of the participants today, our panelists, Director Doug Holscher, Senator Ernst, Congresswoman Axney, and all the great county officials that are out there that are doing the work every day to make their communities safe and sound for their citizens. Finally, I want to mention that next Friday, we will be hosting at 1 p.m., so this will be Friday, April 17th, call with state leaders. Governor Reynolds has set aside some time for us to participate in that call next Friday. So please keep an eye out for some additional information that we'll be sending out to you. Finally, in the update that we sent out to membership earlier this morning and an email that we sent out yesterday was a survey related to actions related to your employees and whether or not they're working or they're being furloughed, whether you're paying for their benefits. It would really be helpful for us to be able to capture information about that so that we can share that with our state and federal partners as we try and provide information to them that help them make decisions that really make a difference on the ground. So with that, we will close out the call and webinar today, and appreciate everybody's time. Thanks a lot. Be safe and have a nice weekend.